Hi everybody, Dustin Klein here with Sun Valley at our Dunlap location with one of our newest patients, Kathy, who's a 2-year patient in the system, first year with us, and she's been gracious enough to give us some time and explain about her experience at Sun Valley and how she's transitioned from opioids and over-the-counter painkillers to cannabis to help her with all of her conditions. So first of all, Kathy, thank you for being here.
Thank you for having me.
Joining us.
Yeah.
The first question would be, so when you just got certified by us at our Dunlap clinic
Yes.
just a couple weeks ago,
Yes.
right?
Yes.
But you've been in the program for a year.
Yes.
So the first question I always got to ask is, what were the differences? I don't want to speak on negative, but what were the positive differences between your experience at the Sun Valley and your first year?
The doctor here is awesome. She read me she knew all about me just by looking at my application. She could tell what type of personality I had, and then the more I got to talking to her, the more my personality comes out. So she really...
She allowed that to happen.
Yeah, so she was excellent. She was just excellent. I was, very, very laid back atmosphere, very comfortable. If you could make a doctor's appointment and sit in a doctor's office, you can certainly come here because it is so easy to do.
Well, that's the whole point of what Sun Valley is about, is stripping away all the stress, all the homework, all the headache, everything that comes along with getting through this process and getting that card. The whole goal is to take that off your back and make it a breeze for the patient.
Yeah.
So I'm glad you saw that. And all of our doctors are fantastic, and just like our employees, they do their best just to understand the individual needs of the patient.
Yeah.
So let's get to what brought you here. So why did you start using cannabis? Were you dealing with a past condition or?
Yeah, so I've actually had a bad motorcycle accident in 2011.
Oh.
But prior to that, I started in 2009, I've actually had 4 major surgeries. So I have been in the hospital a lot. I actually,
Sorry to hear that.
Yeah, unfortunately, I actually got addicted to opiates. When I was in the hospital, I kept after my doctor. Why am I taking all these pills? But they just kept pushing them on me. So when I got home, I'm still on these pills, realizing I shouldn't be on this stuff. Quit cold turkey, and boy,
congrats. That's very difficult and kind of dangerous.
well, I knew it wasn't good for me. So I quit cold turkey and had some bad experiences with that, but I did it. And then now I'm on over-the-counter medication. So I'm taking Excedrin, extra strength Excedrin, extra strength Tylenol, that kind of stuff. And I'm taking 6 a day, and I know that that's not good for me. So I've got family that are in this business, so I've learned an awful lot. I got educated on this stuff.
Yep.
And I started off slow because
I'm guessing you hadn't consumed cannabis before,
No.
been a smoker?
I did it when I was a teenager, because we all do it back then, But I did it back then as a teenager, never liked the idea of being high. I need to be in control of myself, so that was how I felt. But I love it now because I usually use the indica products at night for sleeping. I sleep like a baby.
And how do you consume?
Edibles. I do
Edibles.
all edibles. Yeah,
Awesome.
all edibles.
So you were able to never smoke. You use this right from the beginning.
Yeah, so I've actually tried the pre-rolls that we get at the different dispensaries, and I don't like to smoke. I'm here to tell you, because I never even smoked a cigarette. So
it's a preference. It's
a
not
preference.
necessary
Right.
at all when you're in a medical program
Right.
like Arizona, where you have so many products. There's more products that are non-smokable than smokable.
Yeah.
So.
And what's also interesting is when you go into a dispensary, the folks behind the counter there, those bud tenders, they know their stuff. They really do. They're very smart. And all you got to do is tell them, this is what I'm having a problem with, and they will help you out.
Yeah. So you're in over a year now. You consume edibles. You don't need to smoke to do it.
No.
You're completely off pills?
Completely off pills.
How long?
A year. I mean,
wonderful, Kathy.
that was kind of the goal. I knew I needed to get off of the pills. So, and they're over the counter, but they're still not good for you,
Yep.
So I knew that I needed to do that. So this has helped me tremendously.
Well,
Yeah.
I'm so glad to hear it, and I'm glad you gave us a shot and tried out Sun Valley. And I hope we're here for you
Yeah.
for year after year.
Yeah, because
And
I will be back.
as our program expands, as more dispensaries create better products, the whole medical program here in Arizona is just going to keep growing and helping more and more people like yourself get off of
Yeah.
pills.
Yeah.
So thank you for sharing your experience
Not a
with us.
problem. Thank you for having me.
All right. Until next time, this is Dustin with Sun Valley and Kathy. Have a good one.
Thank you.